Hi, and welcome to the Changing Perspectives podcast, the show where we discuss a variety of topics including grief, parenting, health and wellness, and relationships. Join us and explore a number of changing perspectives. We're your hosts, Jenni and Josh Brennan. Well, hey, Jenni.
Hi.
It's been a while.
I feel like it's been a long time.
I know. Well, we're at episode 27, which is exciting. This will come out on Thursday. Oh, no, that's next week. I was all excited because next week is June 27th. I thought episode 27, whatever. Anywho, we took a little one-day break. We normally have an episode that drops on Mondays and Thursdays, but we had to take a break. I'm going to tell everybody why we took a break. Is that okay?
Sure. Yeah,
okay.
Go right ahead.
So we were to go with our Disney love, to use a term Disney uses all the time, refurbishment. Changing Perspectives was going under a little refurbishment, actually. So we're going to post some pictures on our Instagram and Facebook pages of the new setup. You know, everybody that is a homegrown podcast at home and you have your home studio, I think when you first get started, you always sort of go through that growth and development phase and different equipment. And we started very simply. We started very simply, and we had some basic setups and some microphones, and we went through some growth, and we had some different audio issues. Jenni likes to show her cell phone presence up on the microphones.
I don't know why it does that.
Your cell phone does it all the time.
But it's like off. I have my cell phone.
I don't know.
It's just on
the data?
Wi-Fi.
Oh,
No, the data's off. Yeah.
Yeah, I hear it. Anyway,
I was taking pictures for Instagram.
Oh, well, thank you.
I was multitasking.
People heard that pictures being taken. I love it. So anyway, I'm going to bore the crap out of people here, but the bottom line is we took a break, a day off from releasing episodes so we could install and test our new equipment, and we have new microphones that will require a lot less post fixing after the episode's recorded, hopefully. So hopefully we are putting all of that stuff out for you, and you love the audio. So I hope you can just bear with us on some of the previous audio. Hopefully it wasn't too bad. I know the previous episode, Jenni sounded a little farther away than I did because we were testing out another microphone, but we have decided that microphone is no good for us, and so we have two new mics, and hopefully everything will be good. I think that was all I wanted to say about that.
Oh, was it?
Yeah.
I wasn't paying attention. I zone out when you start that process.
Okay. Well, anyway, that's why we took a break. We're happy to be back with everybody. This is episode 27. But don't forget to like us and review us and follow us on all of our social media outlets and Instagram and Facebook and all that stuff. Check out our previous episodes. We have some exciting stuff coming up for you. We're doing some interviews and spots on some different shows coming up. Pop Culture Cosmos at the end of the month, and Shut Up and Dad, great podcast, coming up in July. And we have some upcoming interviews, Jenni. Who's coming on with us?
We do. We've had to shuffle some things around because of their schedules and ours. It's a really busy time of the year, not
really
just for us, but for lots of folks. So we have someone coming on to talk specifically about anxiety and mindfulness. I didn't tell you this. She's going to really focus on mindfulness,
awesome.
which has been on our topic list. We also have someone coming on to talk about cultures with regards to grief. And so she is writing a really cool book, I'm very jealous, where she is traveling to 7 different death and sort of grief festivals, events throughout the world.
Wow.
And talking about them. So she's coming on. Did we schedule that one? I don't remember which is when. I'd have to look at my notes. And then we also have a mom, a really funny mom coming on who lives in England. She's an American who relocated to England. She's had experience with breast cancer and grief and relocating her kids. And so she's pretty fun to watch and follow on Instagram. So I think those 3 we have coming up. I think all of them are before the middle of July. And then we also have sort of a happiness expert coming on as well. So trying to get that all scheduled.
That's interesting.
Yeah, she runs this, she has a daily podcast of like a 10, 15 minute episode every day where it's a good one to follow. sort of like a lesson plan in a way.
I like that.
She's really intriguing. I really like her. And so what is that, 4 over the next
Yes.
4 to 6 weeks or so. So that is our plan. And you're trying to take a picture right now
Yeah.
while I'm talking and telling me to smile.
Well,
so
I got a good shot of you, so.
Well,
I wanted to return the favor
because
oh no, it's good. Well, you were taking a picture of me while I was talking earlier and distracting me.
But I was being artistic, and your face wasn't really in it.
Oh, well, this is a straight up shot of you.
Well,
so
that's not going to make.
Do you want to see it?
That's not going to see the light of day.
I think you're going to like it.
How come your phone doesn't make the sound?
I don't know.
We have the same phone. No, yours is like a newer one, right? But same phone service.
I thought yours was newer than mine. Is that not good?
Oh, that's okay.
I told you it was good.
That's
I get I got the shot on my microphone and your microphone.
Okay, all right.
I
What was I just talking about?
So listen, I want to tell everybody, I set up this new table. We have these new mic arms stands that connect to the table, and we have lots of space for like workspace to have notes and drinks while we not fun drinks, but maybe that's a different episode. And I set up this whole thing, and I set up a chair for Jenny. She comes in and sits down on the couch.
Well, let's think about why I did that. I just spent 2 hours and 15 minutes sitting in that chair in the kitchen, in a meeting, and then class.
Right.
And then tonight I'm going to sit in the same spot for another 2-hour class.
That's the same chair that I put in here.
And it's the same chair.
I get it.
So I needed another.
I'm with you. But the microphone reaches you in the chair.
Right, because I got a microphone arm, so I don't have to hold it.
Yeah.
Yeah, okay. All right.
Are you okay not holding it? Because you said before in previous episodes you like to hold it.
I am. I'm going to need a pen. I need a fidget toy.
Oh, I can give you a pen. I've
Just
got
to
pens.
hold.
Yeah.
If you've had me in a real live class, I always am holding something. A
What
pen.
do you hold? What do you? Oh, a pen.
Usually a pen.
Okay, I've got a pen for you.
I also hold a pen in session with clients, even though I don't really take notes.
Take notes.
Yeah.
That's interesting.
I take notes sometimes, but I'm not someone that like writes down every single thing they say, because then I'm not really paying attention.
Because you're in it.
I'm in it, exactly.
You're listening.
Yeah.
You're present. That's big. All right, Jenny, I think we've vamped enough. What are we talking about today in episode 27?
I don't really know.
Okay. Maybe we should know before we press record.
We are kind of going back to the basics of grief. So we've talked obviously about grief on a lot of our episodes, and we've kind of defined grief, but we've never really dived into the topic of complicated grief, because there really is 2 different kinds of grief.
Right.
I'm getting distracted because my headphones sort of are a little lagging behind, I feel. So sorry about that. I'm going to take them off a little bit.
You have one on, one off?
I have them both half off.
Gotcha.
Somehow it helps me.
Okay.
So there's sort of normal, which I don't really like calling normal, but there's complicated and uncomplicated grief. So another sort of word for uncomplicated grief is normal grief. This is sort of what the vast majority of cases of grief are. They're really normal. So I'm going to ask you, Josh, what are some ways that, without looking at your notes here.
I haven't looked at it.
What are some sort of normal emotional reactions one might have when they're experiencing normal or uncomplicated grief?
Well, the first thing that comes to mind is just weeping, crying.
Yep, crying.
So I guess the other thing is anger or acting angry.
Yep.
Being withdrawn, not wanting to talk to anybody.
Yep.
I guess blaming oneself.
So guilt.
Guilt.
Yep.
Yeah. What comes to mind, we talked about this in other episodes. I can't remember which ones, but some of our grief episodes or hospice episodes, we talk about the phrase grieving appropriately.
Oh, yeah.
And is that, I mean, are clinicians referring to normal or uncomplicated grief when they say that? Grieving appropriately? Is that what that is, I guess?
I guess we could probably argue that maybe they are. I don't really think they are. But I think when they're saying that, they're saying we don't need to have, there's no need for intervention. So, yeah, maybe. Okay. Maybe when they're saying grieving appropriately, they're saying this is a sort of normal, uncomplicated presentation of grief.
So I wanted to go back to what I said first, which was crying or weeping, right? I think that's what comes to mind first when you ask, what do people do when they grieve? What is a normal way to grieve?
Well, I asked a normal emotional response.
Normal emotional response. What comes to mind though is when people see someone crying, they don't act like it's normal. They act like it's so scary or so like, I don't want to talk to that. It's uncomfortable when someone's crying. So we describe it as a normal response to death, but we also get really nervous around it.
Depending on your culture and your sort of background, that's dependent upon your experiences. There are some people who come from a cultural background, a sort of family experience with grief, where that is quite normal for them. So we were watching Big Little Lies?
Big Little Lies.
Is that on HBO or
Yep.
Showtime? What is it?
HBO. I was hoping you were going to bring this up. I was going to ask you.
Yeah, so we just started watching that, and I think we binged it in like a 2-week period.
We're caught up, though.
And we're caught up now.
Yeah.
So we were watching, I think it was in the first episode of the second season, and you're telling me something.
I'm just going to tell you, pull the mic a little farther away from you.
Farther away, okay.
Yes.
So
that should work.
Without giving any spoilers, there's a character in the first episode of the second season who is talking about her grief sort of at a dinner table with another woman and 2 kids who are like second graders. And she talks about her grief experience, and she talks about how she feels so sad and so lonely. And then she talks about how she's mad, all of which are really normal feelings when we're talking about sort of normal, uncomplicated grief. And then she says, "Don't you ever just want to scream?" And I'm not quoting her directly. But then she does. She actually screams at the dinner table, and you know, the other woman, who's sort of this, like, I guess I would say kind of prim and proper woman, is kind of horrified by that expression of grief. But I think that expression of grief is still normal. It's not complicated grief. It is still sort of a very kind of fresh, raw loss for this person.
Right.
And then she actually says, "Oh, does my grief make you uncomfortable?"
Yeah.
Or something like that. And I think that's so true of grief. And so I wanted to talk today about what is normal grief, and then when does grief sort of cross the threshold into something that we consider not abnormal, but complicated.
Right.
That really truly needs some professional intervention and support. So, because we've never really explored that. So I wanted to kind of provide a baseline of what's sort of normal, uncomplicated grief.
If you haven't started watching Big Little Lies on HBO, check that out. It's very good.
It is, yeah.
But when we saw that that scene, the first thing I thought was, we should talk about this on the podcast.
Yeah, I mean, there's
some
definitely
sort of episode.
Grief is definitely a sort of character.
It's a ubiquitous part of the show, I think.
Yeah. Not just death-related grief, but sort of like grief that comes as a result of divorce and loss of friendships and trauma and there's lots there.
Interesting.
All
Okay.
right. So normal kind of
this.
Normal uncomplicated grief.
Was I correct? Or
yeah. Oh, all those were correct.
Okay.
So there's sort of 4 buckets of how grief can present itself: emotionally, physically, cognitively, and then behaviorally.
Okay.
So this is not an exhaustive list, but a kind of example of emotions that are normal when you're talking about grief are things like sadness, anger, guilt. You said all 3 of those. Anxiety, shock, disbelief, yearning, this sort of desire to kind of find them again. So you will often kind of see them, you know, think like, oh, that person in the grocery store really looks like my loved one.
Yeah.
That can throw you off. Sometimes sort of even sort of hallucinating that a little bit. That's normal. That doesn't mean that it's complicated or abnormal. You know, that desire to kind of see your loved one again is really quite palpable, and we see it in nature. So when the study was with geese, a geese lost his partner and then just spent days and weeks just flying, searching for his partner who was dead. But it was this sort of biological need to kind of reconnect that yearning to find them again. We saw that when our dog, anytime we've had a dog and another dog has died, that dog definitely grieves and is kind of like yearning and searching for them. Also feeling of relief when your loved one dies. Yeah. That can also be really normal if they've suffered.
Way?
If they've suffered. Okay. So like, all right, now I know I don't have to fear that every time the phone rings, it's the notice that they've died.
Yeah.
Or, I no longer have to kind of sit and watch them for 7 straight days, wondering if today's the day they're going to take their last breath. So sometimes, quite often, a feeling that you can get when you lose someone is a sense of relief at some point.
Yeah.
That, okay, well, at least, now they're gone. I think we felt that with our dog in some ways.
Yeah.
Our last one, as we sort of struggled with when is the time to have her euthanized, to pursue sort of putting her down.
I think we should do another episode on pet loss from the perspective of the adult or the parent. I think we talked, or not even a parent, just an adult.
The adult.
Because we talked a lot. We just only did one episode on that. And we talked about children's responses to that, how to guide children through pet loss. But that topic came up with our friends recently about
3 different sets of friends.
Yeah, like how do we know,
3 days.
How do we know when it's time?
Right.
And we didn't know, and that's part of the relief that you're talking about. Once we finally knew that it was happening, this was the day.
Okay. Let's table that part, and we can do a separate episode on that. I'll be curious to see the numbers because the pet loss for children one is our least downloaded episode.
Do you think that's because people are a little afraid of that topic?
Yeah, no one wants to talk about dead dogs. So it'll be interesting to see if more people would want to talk about it when it's sort of specifically framed in another way.
And let me just pause for a second and say that part of what I love about this podcast so much and doing the show with you is just how many different types of topics that we talk about. And, as if you're listening to the show, you know how much we love animals because animals seem to be to muscle their way on the show all the time.
You may even hear Pixie purring right now. She's sitting on my lap.
She's sitting on your lap. So animals are a big part of our life. And because of Jenni's specialty being grief and loss, I mean, it's natural for us to start off talking about that from that perspective. But Jenni has been kind enough to let me be a guest author on her blog. And I'm currently working on an article about pet rescue, and I'd love to do a show.
You've been working on that for like 4 months.
I know, but I don't have a lot of time to do that. But anyway, I'm working on that article, so an episode is coming maybe later this summer or early fall about pet rescue. So anyway, let's proceed.
Cool. So back to sort of normal range of emotional responses. Also numbness, not really feeling anything.
Right.
Those are not an exhaustive list, but just a sort of list of the range of normal, typical, uncomplicated responses when someone is grieving. So nothing really alarming there.
Mm-hmm. I have a question for you.
Yes.
I think a natural response to death, or even a non-death related loss, is this feeling of, I just want to go back. I just want to go back to the moment that I found out about this, or before. Let me just go back to the time that they were still here. Is that part of yearning?
Yes.
Okay.
What do you mean I go back to the moment that I learned about it, though?
So I could warn them if it was like a traumatic death or something, or
gotcha.
Let me just go back to that moment. I wish I had made a different decision, or I wish I had this time with them, or whatever.
Yeah, I mean, part of that could be guilt,
it's regret.
Regret.
I guess regret is what I'm talking about.
Okay,
I think.
So regret, yes, that's totally normal.
Okay.
Yeah, for sure.
Well, it fits within the emotional category.
Yep. Other ones that you can think of?
I think numbness is interesting to me. I guess that's what I was talking about with feeling withdrawn, wanting to pull away from the world. Is that, I guess, the same thing as numbness?
Well, that's a behavioral reaction.
Okay.
Right? That's sort of pulling away. And that could be because you're numb, or it could be because you just don't want to be around people because sort of triggers you in a way. It's all kind of complicated. It all, I'm saying here's 4 different buckets of how grief can present itself, but there are things that overlap from one bucket to another. So it's not necessarily clean and neat. And these kind of can depend on what sort of task or stage or place you're at with your grief process.
Mm-hmm.
The sort of theoretical approach I often sort of utilize is that very early on, after you've lost someone, what you're trying to do is really understand that they've died.
Right.
Really kind of accept the loss, the reality of the loss, that it's really happened. And so often in that time, that's when we see feelings of numbness, when we have feelings of yearning, when we know they're not here, but it really hasn't kind of sunk in. It hasn't hit us yet. Okay. Other questions?
No, I think that's it.
Okay.
Yeah.
So next bucket is sort of physical reactions. So how might you think sort of grief can be manifested physically in a normal way?
The first thing that comes to mind is like trouble breathing, like hyperventilation or whatnot, something like that.
Right, that kind of feeling, like tightness in your chest, like you can't catch your breath, fast breathing, all that kind of stuff. There's lots of people that sort of feel their grief in a respiratory way. Also things like just general weakness, not wanting to eat, dry mouth. The actual act of crying is a physical reaction.
I guess that makes sense.
Yeah, like vomiting, choking, having sort of a choking sensation. And then other sort of physical ailments. So people can feel grief, a stomach ache or muscle cramps or tightness in their shoulders or headaches. Really, grief can be manifested anywhere in your body physically.
And what is the physiological reason that we have those physical reactions? Is it just like a mind-body connection?
That mind-body connection. There's a lot of new research that actually is showing that our sort of physical reactions can get passed down. So trauma that perhaps it sort of comes out of research from like people that lived during wars. That lived in a war area, where they were worried about bombings and things like that. So they were living in this constant sort of trauma. So daily, multiple times a day, their brain was kind of getting that signal, fight or flight, there's a signal, or there's a mortar, or there's a bomb. So I've got to protect myself. I've got to protect my offspring. I've got to protect the people I love. And so that's releasing these chemicals that's telling your brain to sort of shut down all non-essential functioning and just fight or flee, but protect yourself. And so living in that constantly can kind of change the sort of chemical makeup of your brain, can kind of change then what your body does, if you're kind of tense all the time. And then if you have children, so if you're pregnant during that time, or if you then become pregnant, a lot of research is showing that kind of biologically gets kind of passed down.
Interesting.
That sort of trauma response. And so it gets passed down biologically, genetically then, but also socially, right? Because if you're someone who kind of grew up where if you heard a loud noise, that could mean that if you heard airplanes, that could mean that they're coming to drop bombs on you. Then anytime you hear an airplane, you might freak your children out and be like, come on, we have to get somewhere safe. So then as those children grow up, now then they've got those feelings that are passed down too. So all that to say, a lot of our feelings we can feel physically in our bodies.
I think that makes sense. Did you say joint pain?
I don't know if I said it, but that can definitely be it too. Same with anxiety. I see a lot of folks that come to me for anxiety after they've sort of gone through lots of testing with their doctors, and the doctors are finally like, nothing's wrong with you. You must be anxious. And then more often than not, it is true. There's something in their life that's causing them a whole lot of anxiety. And sometimes I think it's the brain and the body's way of sort of giving them a warning, like, hey, you need to take care of, like, we are so not doing well right now that, we're going to be dizzy and not make it able for you to drive. I think we don't quite fully understand the magical things our brains can do.
Right.
So lots of physical reactions that are totally normal for a grief response.
I was just going to say, this is uncomplicated.
All of this is still talking about uncomplicated
category.
Grief. Yeah.
Okay.
And then cognitive. So those are your thoughts. So things like thinking, this isn't real. Why did this happen? only being able to think about it, like thinking about it all the time, sort of perseverating on it, being preoccupied with it, being confused about it, sort of, why did this happen? I don't understand. This isn't fair. Not being able to concentrate is a pretty big one. Not being able to kind of focus at work, things like that. And I think if you kind of think about yourself, there's probably times of the day that you're a better worker.
Yeah.
Right.
Absolutely.
I know for me, I work so much better earlier in the day. Like, my brain just fires quicker. I'm more organized. I can concentrate better. I can write better. But at the end of the day, I just don't have that concentration level. And I think for many people, sort of, our brains do that anyways, even when we're not grieving. Our brains sort of give us signals and say, now's a good time for you to do this work. Now's not a good time to do this work. And for people that are grieving, it can be really common for them to kind of feel that way all the time when they're grieving.
For me, the disbelief thing rings true. I feel like when I've had a loss, those are the things that the thoughts that pop into my mind. I can't believe this is happening. Please make it not be happening. Right. I can't believe this, So that one rings true for me.
And then also forgetfulness. So a lot of people sort of get worried. Oh my gosh, am I now on top of all this? Am I developing like early stage dementia?
Right.
And sometimes people might be, right? But so often that's a normal reaction to grief.
Yeah.
It's also a normal trauma. A lot of this is also true of trauma. These are sort of true reactions to trauma, is that people can feel like they're going crazy. And I experienced that. I've got sort of this very mild brain condition. And so we sort of stumbled across that 5 years ago.
Yeah.
When I woke up from a nap and one of my eyeballs was, my pupils was, one of my pupils were dilated. The other was not. Yeah. And apparently when you walked in and saw me, that was pretty concerning.
Yeah.
And so off to the hospital, because that could be indicative of a brain issue. And they were pretty concerned. And so off to the bigger hospital, I went in an ambulance and had a CT scan done, which at that point, were they concerned about it then? No, it didn't look abnormal to them then, right?
No.
But
then the MRI.
Then a few years later, I was forgetting things. I was sort of messing up numbers a little bit. I was forgetting people's names. I was having a hard time concentrating. And then as I was realizing that, I was getting more and more freaked out. Mentioned it to a doctor, and the doctor said, well, you did have this weird unexplained eye thing that happened a few years ago that you needed a CT for, so you should go to a neurologist.
Right.
Went to a neurologist, and she sort of nonchalantly was like, draw me a clock. And I knew she was giving me the clock test. I worked with patients with dementia. I knew exactly what she was looking for, and I couldn't draw the clock. Like, in that moment, were you in the room with me?
No.
So in that moment, she said, draw a clock that says 1:50, and I couldn't do it. And then realizing in that moment that I couldn't do it freaked me out, which made me more unable to do it. So then I had lots of MRIs and a full neuropsych assessment. And the conclusion is that basically I've got a weird brain, because the first MRI came back and it looked like my frontal lobe was atrophied, which could be indicative of a pretty significant sort of form of dementia, which was terrifying. And all this was like a month-long process before we finally got an answer. Do you remember?
Yeah.
It was a while.
I feel like it was a couple months.
It was a long process.
Yeah.
Long
I didn't mean
story.
to have a laugh in there, but you said, I've just got a weird brain.
Well, because that's what it is. So I've got like this basically idiopathic
hypertension,
hyper and hypotensive intracranial So I've got idiopathic intracranial hypertension and hypotension. So depending on whether sort of the pressure in my brain is up or down, it's going to look like my brain has atrophied, when in fact I've just got a little extra space in there for the swelling. So,
and idiopathic stands for unknown cause.
They don't really know why. Yeah. The only concern is that I have to watch my sort of optical nerves, because there's a danger to that. But I have no symptoms. And their conclusion was I was forgetting things. I wasn't able to draw the clock, not because I had dementia, but because I was stressed and I was anxious and I was overwhelmed. And so that is something, and I hadn't experienced a big loss. I just was working like 17 jobs at that time.
Yes.
I was working a lot. I think we I don't remember we had like a big shift sort of in our lives in terms of our schedules. And so that was what was going on.
It wasn't
with
that
me.
long after you moved, right?
Right. I think so. So that was what was going on. So I've lived and breathed that your brain really can do funny things when you are anxious.
Absolutely.
And the same thing can happen when you're grieving. So all of those same sort of symptoms can come across when you're grieving. So those can be kind of normal as well. And then your sort of bucket of behaviors. So socially withdrawing or not wanting to be alone, right? Like not wanting to sleep alone, not wanting to sort of be in a house alone, not wanting to drive alone, all of those things, or not wanting to socialize at all are all sort of normal reactions. On this list here is the term mummification. Do you know what that means?
Does that mean like wrapping, like physically adding layers to yourself?
No, but that's a good guess. I guess you could, a good guess would be like wearing their clothing, right?
Well, yeah, like I think of people just layering clothing, wrapping themselves up in a blanket, maybe laying in bed for days.
Oh, yeah.
That's what I think.
That is a normal reaction to grief, not what the term mummification means. It actually refers to sort of preserving everything as it was when the loved one was here. So, like,
interesting.
Not changing anything in the house. Like,
okay, I get that.
That's their coat hook. That's their backpack. Their backpack's always on the table. Their room always looks like this. This is their spot at the dining room table. That's their spot for the car in the driveway, things like that. Leaving it as if you're kind of mummifying their sort of place
I get that.
in your life.
Preservation.
Yeah. So that's also really normal. Not sleeping too much, being restless. Also the sort of physical act of sighing that like people do that a lot when they're grieving without really realizing all of that. So everything I've just laid out, totally normal, uncomplicated grief. And so many of what we've talked about in our episodes about grief are kind of based in that sort of normal, uncomplicated grief, wide range. But I do think it's worthwhile exploring, well, what is sort of the other side? What's complicated grief? And I don't want to call it abnormal grief, but what's complicated grief?
Dive into that. Why don't we go ahead and take a quick break?
Okay.
We'll be right back.
What's up, everybody? My name's Tim from the Shut Up and Dad podcast, and I hope you're enjoying this show. If you're looking for some laughs after you finish listening to this episode, come check out Shut Up and Dad. You can find us on Facebook, Instagram, Twitter, and your favorite podcast platform by searching Shut Up and Dad, or simply head to our website, shutupanddad-podcast.com, where you can listen to episodes, read our blog, and find links to our show. That's shutupanddad-podcast.com.
All right, we are back. Jenny, you're about to take us through the other side, which is complicated grief.
Complicated grief. So there's 4 types of complicated grief. There is chronic, delayed, exaggerated, and masked. So I'll sort of talk about each one.
All right.
And you can tell me if you've sort of ever seen them. So the first 2, chronic and delayed, are the most common. And I guess sort of the least concerning of the complicated grief types. So the first one, chronic, refers to grief that's really kind of excessive in duration. So there's no real time. Like I can't say, oh, if you're still experiencing these grief reactions after 4 years, then you've got chronic grief. It's really on a case-by-case basis, but it's something that's really excessive and really the person feels stuck. So they don't just feel like they're grieving. They really feel like they're just stuck in the same place. They don't necessarily have good days and bad days. Their grief and their grieving process doesn't feel like it's moving or changing or sort of ebbing or flowing. It just feels like they're stuck. And so often someone that's presenting with a chronic grief, a chronic complicated grief, that's what they're saying, is that they feel stuck.
So how is that? Let's go back to what you said in previous episodes about how there is no closure. Right. There's no end point for loss or grief. So how is that? What's the difference between? How is that different than getting unstuck? I guess.
All right. So your question is basically like, how is normal
If
grief?
there's no closure, then what is chronic?
Well, you can still be grieving someone. You can still be really sad that they're not there. You can still sort of be caught off guard. When you suddenly remember them, you can still wake up every day and sit and look at the tree you've planted in their memory and kind of, think of them and miss them.
So that's different than, having a satisfactory conclusion is not closure.
Right.
Right. It's just
I didn't say satisfactory. You're looking at the notes.
I'm looking at the notes.
Yeah,
right,
I didn't say that because I don't like to say that.
Right, because that's too close to closure. Mm-hmm. Right.
Yeah.
There is no closure.
Yeah.
But people can move to different paths in the grief journey.
Yeah. So I guess I like imagery, and I've
So do I.
likened and I think I've likened grief. I think here to sort of rocks, and so some days your grief feels like you're carrying around a boulder, right? And it feels like that boulder is so heavy you can't even get out of bed. It's just on your back. You can't stand up straight. You can't really catch your breath. You don't want to do anything. It's just this heavy boulder that's weighing you down. And other days it's this tiny little pebble. It's there. It's in your pocket. It's not going to go anywhere. It's always going to be with you. You can feel it. It's right there, but it's not weighing you down. It's not preventing you from doing anything. So some days it's a boulder, some days it's a pebble, some days it's something in between. Someone with chronic grief, it's always going to feel like maybe not a boulder, but it's always going to feel the same for them day after day. It doesn't ever change.
Well, and you mentioned a large boulder that prevents you from doing something, right?
Yeah.
If you're stuck there with that large boulder and you can't do anything, I'm getting it now. It's like,
Yeah.
I get light bulbs now.
Yeah.
Now I'm getting it. So if
Yes.
you're stuck in that space where you can't do anything, or maybe you continue to have weakness or disbelief, or you never fully get your appetite back because you're stuck in that chronic.
Yeah. I mean, sort of the next sort of, if you're kind of looking at it on a continuum, don't want to confuse chronic with then exaggerated grief, because exaggerated grief, which is the third bucket I was going to talk about, that's when it sort of flips into something really that's a clinical diagnosis, like depression, anxiety, panic attacks, or phobias that develop. Suddenly you have agoraphobia and you can't leave your home because of a loss. Substance abuse or substance misuse that happens as a result of a loss. Things like PTSD. When your grief is sort of moving to that phase, then we're really talking about it being an exaggerated form of grief, which is a complicated form of grief. Chronic is sort of, I guess, in between uncomplicated and exaggerated. Right. But both chronic and exaggerated are types of complicated grief.
I see.
Okay. And the distinction between complicated and uncomplicated, when we're talking about uncomplicated grief or normal grief, the vast majority of people who are grieving experience normal, uncomplicated grief. And the vast majority are able to sort of move through that without real professional intervention.
Right.
They may never need to go to like a grief support group or a grief therapist. They may never need to see a psychiatrist. They may never need to get regular counseling or therapy. When we're talking about complicated grief, those individuals that are experiencing that really do need professional support. They need a therapist, a clinician, not someone who's a licensed provider, not someone who studied grief for a couple years and has taken sort of a certificate, someone who's really kind of focused.
A licensed clinician.
They need someone whose support is a little more than like a friend or a peer support group, a peer bereavement group. When we're moving into complicated grief, and that's why I bring it up today, is because if you are identifying with any of this, or you feel like you know someone who might be identifying with this, any of these types of complicated grief, that's a good time to sort of get some additional support, professional support.
Right.
So that first kind of bucket is chronic grief.
Okay.
The second bucket is delayed grief, which is exactly what we're talking about. Exactly what it sounds like. It's grief that is delayed. And so often people can experience a pretty significant loss. And then not really experience a whole lot of those emotions that we felt, that we talked about at the beginning. I got distracted by our teenager who just stood there staring at us and sort of, it's going to be complicated. We're going to have complicated podcasting for the next 12 weeks because we've transitioned into summer. So the kids are here all the time. So what was I saying? Talking about delayed
grief.
Delayed complicated grief is exactly what it is. So someone can lose someone important to them and really not experience a whole lot of that normal grief examples we talked about. They might not really feel anything and sort of just go on with their life. And then suddenly something happens. Another loss happens, or they watch a movie, or they hear a song, or an anniversary happens, and then suddenly their grief kicks in. Right. And it's as if they just lost them for the very, very first time. It's not that they're doing it again. This is the first time they're grieving.
And it could be months or years later.
It could be years later. With the fact that it's 2019 right now, not all families kind of live together nearby. Many individuals are living paycheck to paycheck. So if a death kind of happens to someone important to them 2,000 miles away, they might not be able to jump on an airplane and attend the funeral, the wake. And so it might be really easy for them to pretend like that loss never happened.
Right.
And so delayed grief reactions are really quite common. But they can catch people off guard because they can say like, well, but my parents died 4 years ago. Why am I sad about it now? I was fine.
Yeah.
It didn't bother me at all. The answer is probably because you didn't grieve at all. And that could be grief that's not just about like a death. It could be grief over a divorce or something like that.
Right.
That kind of delayed grief. So when we're talking about chronic grief, which is really kind of excessive in duration, you're kind of stuck. And delayed grief that you experience pretty far after the beginning time of the loss, those are both complicated grief examples. So
now when that happens and you after months, years, whatever it is, you have this response, this reaction to the loss, you then could be experiencing all of the uncomplicated stuff.
Correct.
As well. Like all of that could come up, like the tightness in the chest, all the physical stuff, the cognitive stuff, all the emotional stuff. So you're suddenly in the space where you, quote unquote, should have been.
Exactly. But so the people around you, your support network, is not prepared for that.
They're going to be like, what is going on with this person?
Something's wrong with you.
Yeah.
Which is why turning to professional support at that time might be really helpful. And that doesn't mean like I'm talking check yourself into a hospital. I'm talking like go see a grief therapist, not a counselor. There's a distinction between grief counseling and grief therapy. But go see a grief therapist who is a licensed professional.
Okay. So grief therapy is licensed professional.
Right.
Where do you find...
Who's going to use really specific sort of clinical interventions. And there are actual specific clinicians that can be trained in complicated grief techniques, which is a very sort of short, time-limited program, often 8 to 12-week program. Like this is what we do week 1, this is what we do week 2. I am not certified in that. It is on my list of things to do when I ever have time.
So how do you find, what's a grief counselor then? Is that someone that works, volunteers somewhere?
Yep, it could be.
Like at a church or something?
Exactly.
Okay. All right.
Exactly.
Like what we saw in Dead to Me, probably.
Yes.
Yeah, okay.
Exactly.
They're
not
TV
bad.
Show. Yeah.
They're just probably not going to be able to take you the full length.
And they're not going to diagnose anything.
Exactly.
Yeah, I get it. Okay. Thank you.
So chronic and delayed. You feel like you understand those?
I got it.
Okay. So then the next two, exaggerated and masked, these are ones that can really result in clinical diagnoses. And so actually may also benefit from medication. So may also benefit from psychiatric support.
So this is what you were referencing earlier, where there's a diagnosis made.
Yes.
And you should be under the care of.
Yeah. And I don't really like the terms. So often when we talk about things, I'm like, I don't like the way that this I don't like this theorist. I don't like the term exaggerated because I feel like exaggerated is a negative, has a negative connotation. Like, oh, you're exaggerating. So I feel like it's a negative term, right?
It's like, oh, they're playing the death card.
Yeah, exactly.
Yeah.
When they're not, it's that things have sort of shifted clinically for them. So perhaps they had an underlying predisposition to depression or anxiety, or they had a diagnosis, and then this sort of amplifies it. So we're talking about things like depression, so real hopelessness, real kind of lack of motivation. That boulder, when you said earlier, like you're not able to do things, we're talking about like really not, like you can't put on a bra and get dressed and go to work. Taking a shower daily is work. Brushing your teeth, making yourself meals, like that real kind of dark depression. Anxiety that really gets in the way of your quality of life. These really are starting to kind of impact your quality of life. Obviously, a phobia is going to prevent you from doing something, whether it's a fear of driving, fear of leaving your house, and panic attacks, which when you're having a panic attack can feel like you're actually dying. Yeah. All of those things are pretty significant and need the intervention and support of someone who knows more than just grief counseling, but can kind of bring in some other therapeutic methods. PTSD.
Well, then, because the grief is now not just grief, it's grief plus this mental health diagnosis.
Right. So post-traumatic stress disorder, if we're talking about a loss that had some trauma involved or was sudden in nature, or a loss in which there's a lot of sort of complicated emotions like ambiguity or guilt, things like that, you might be at risk for some PTSD, which would put this into a category of exaggerated grief.
PTSD is on our episode list, right? Like our topic list.
Yeah, we probably should bring in a specialist for that one.
Yeah.
I see folks with PTSD, but I would not classify myself as, I'm a grief specialist, but I'm not a PTSD specialist.
Okay.
But I do see a lot of people who have PTSD. But then if they reach a point where I feel like, all right, we've kind of worked through the grief part, we've worked through some of the other clinical stuff, and now we're kind of stuck around the PTSD,
right?
Then I would refer them out.
Gotcha. All right. So what's left on the buckets of complicated grief?
So masked grief. So masked grief is when, it's really quite interesting because this is an example of what the brain can do. It is when the grieving individual actually starts to develop symptoms that the deceased individual had. So if their loved one had lung cancer and had a lot of respiratory issues at the end of their life, and they suddenly start developing respiratory issues, obviously the first thing you do is you pursue medically and make sure nothing's going on.
Make sure you don't actually
have it. Or they had like an intestinal cancer or stomach cancer, and then they start having GI issues. It could be this complicated masked grief, that your grief is really being displayed physically in a way that's manifesting in a way that your deceased loved one sort of died. So it's really interesting. Really needs someone clinical to help kind of unpack what's going on and kind of shed light on that. So often masked grief, when people are having masked complicated grief, they're not going to the therapist and saying, I've decided that I have masked complicated grief.
Right.
Usually what they're doing is they're going and saying, I have all these medical issues and my doctors aren't able to find anything and I don't know what's going on. And then in uncovering it, the therapist would find that, they've had this significant loss, this is how the person died, and they're having sort of similar symptoms here, and then provide education around how it's normal. So none of this is abnormal. This is still sort of, even complicated grief is within the sort of confines of you're normal if you experience
a normal
this.
Response.
Yes, it's just that you're going to need a little extra help to kind of get through it. It's kind of like if you fall in the parking lot and you twist your ankle, you kind of tweak your ankle. Mm-hmm. If it's not broken, and it doesn't really look like you've totally sprained it, you can treat it yourself, right? You can kind of go home, put some ice on it, rest it, elevate it, do the compression, take some Motrin, all that stuff. Treat it yourself. If it's broken, you really need to go see a professional who's going to kind of reset it, put a cast on. Emotional stuff is the same. Some of it you can kind of deal with your own. You can take care of yourself. You can kind of listen to our other podcast episodes and kind of help yourself process your grief. Right. Sometimes, though, it reaches a point where it's a little more complex. It's a little more complicated, and you could benefit from seeing a professional.
So that's this masked complicated grief concept is pretty interesting to me. Have you ever seen it in the clinical setting?
For sure.
Really?
Yeah. I would say it happens a lot. The brain is pretty amazing.
Or weird.
Well, amazing. I often think of situations like that. I think of it as the sort of brain, the body, cueing the person
Right.
to slow down. I always think of, I don't watch Oprah a lot. Is Oprah even on anymore?
No.
I don't know. I didn't really watch Oprah
She does
a
all
lot.
kinds of different stuff.
I think she has a podcast, actually. But in an episode I did watch, she talked about how she believes that like the universe sends you signals, and sometimes they're little signals, and sometimes they're kind of big signals, like they're throwing bricks at your head.
Yeah.
I kind of think our body and our brain does the same thing. They sort of send us signals.
Mm-hmm.
Sometimes those signals are easy to ignore, and so we ignore them. And then those signals have to get louder and louder. And so
Right.
I sort of look at something like a masked, complicated grief as like your brain, your body kind of throwing bricks at your head. Like,
Yeah.
look, you have to unpack this grief stuff. You have to sort of figure some stuff out. You have to figure out a way to take care of yourself.
Yeah.
And so I'm going to present issues and symptoms that are too great for you to ignore.
Right.
So that's how I look at it.
Okay.
I look at it as sort of a protective
Still
factor.
fascinating to me.
The brain is
Yeah.
fascinating.
So there's a little note. Did you already say this? On my notes here, it says both exaggerated and masked grief can result in a clinical diagnosis, but individuals with exaggerated grief reactions are aware of and connect their reactions to the loss, while individuals with masked grief reactions do not.
I did say that. So I said that people with masked grief are not going to kind of show up and be like, I've lost my loved one and they died of stomach cancer and I'm having stomach aches. And so I know it's just a masked grief. The therapist is going to unpack that.
But folks with exaggerated grief have awareness of what's going on.
Often they do. That they'll be able to say like, things got really worse for me after the loss of my loved one. So the point with all of this is to say that all of this grief is still normal.
Yes.
But I wanted to provide a little bit of a more sort of scientific kind of background and acknowledge that although I say all the time, like what you're feeling is normal, that sometimes
you need extra help.
Sometimes you do need extra help. And there are kind of labels for that. So I wanted to sort of
the labels you're not crazy about.
When we talk about like abnormal grief, when we call uncomplicated grief normal grief, then that means that the complicated grief is
not normal.
Abnormal grief.
Yeah.
So I don't like that word.
Yeah,
abnormal.
I get that.
Yeah.
So uncomplicated and complicated.
Yes.
Stuff you can treat yourself at home or stuff you need help with.
Right. And so if folks are kind of listening to this and thinking, maybe my grief experience is kind of moving into the complicated grief realm, what I would do is I would suggest you go to, if you're here in the U.S., I would suggest you go to Psychology Today, the website, www.psychologytoday.com, and type in your location, type in your insurance, and then type in, it'll allow you to sort of search by therapists based on their specialty and look for a therapist that specializes in grief and one that is licensed, and then reach out to them.
Cool.
To pursue some therapeutic support. Or you can also go to, what was the one I had you write down? The Center for Complicated Grief?
Yeah. We're not at that point in the episode, though.
I was going to say you could go there.
I'll say it again. Center for Complicated Grief.
There's a link on there that you can click.
It'll be in the show notes.
To find a therapist.
Oh, that's right. I just because I pulled up the website as you were talking earlier. There's a bunch of different
resources
there.
Yeah.
Well, do you have anything else for us on uncomplicated and complicated grief?
No, I don't think so.
Okay.
I think if people have questions, though, definitely let us know.
Yes. All right, everybody, that is going to do it for today. Thank you so much for listening. Thanks for bearing with us as we took a break on Monday. You can learn more on this topic by checking out that website we just referenced, the Center for Complicated Grief through Columbia University. It's complicatedgrief.columbia.edu. And you can also check out, of course, jennybrennan.com for other resources and links to different things. As a reminder, this episode was for education and entertainment purposes only. Should you need additional support, please contact your healthcare provider for information and referrals. Please go ahead and follow us on Facebook at Changing Perspectives Podcast and on Instagram at Changing Perspectives Blog. You can check out our website by going to changingperspectivesblog.com or send us an email to changingpodcast@gmail.com. Go ahead and subscribe to the show so you'll never miss an episode, and we will see you next time. Say bye, Jenny.
Bye, Jenny.
The Changing Perspectives podcast is produced, recorded, and edited by Dizzy-Bird Studios, Whitman, Massachusetts. Visit Dizzy-Bird Studios on Facebook, facebook.com/Dizzy-Bird Studios.